Amalgam is a silver metallic filling that is used mainly to fill cavities in the back teeth. It is one of the most commonly used filling materials since it is very strong and lasts a long time. Amalgam is made out of a combination of a few metals such as silver, mercury, and tin. Once the tooth has been filled, the filling is checked to ensure the proper alignment and shape. At this point, any necessary adjustments are made to ensure proper functionality. You should avoid biting or chewing on the filling for at least 24 hours until it completely hardens. Following the filling procedure, it is very common to experience some discomfort, normally at the site of the anesthetic or at the tooth itself. To alleviate the discomfort, it is recommended that you take over-the-counter pain medication. In addition, you may experience sensitivity to cold food and drinks. This sensitivity should resolve in a few days, but if any of these symptoms persist, then you should visit your dentist. In some cases, the decay could be quite deep and close to the nerve of the tooth. In these instances, the nerve could already be infected with bacteria. Even though a filling has been placed, there is still a good chance that the tooth may need to go under root canal therapy to relieve the discomfort. Please keep in mind, the longevity of your filling depends in large part on your oral hygiene and diet, so be sure to maintain your filling with proper brushing and flossing. If you have any additional questions, please consult with your dentist.